we have a moment of silence for Alex? Sure. All right, guys. We're going to have a moment of silence for Alex Trebek. Moment of silence starts now. Okay, thank you.
Okay, that was the moment of silence for Alex Trebek. Okay, we're gonna start. We'll do home team goes first. So here are the categories: dysphagia, peripheral neuropathy, eating disorders, Parkinson's, and random. So we'll do the Delts Schmelts go first since they're home team. What do we got?
Parkinson 500.
Parkinson's for 500. All right. Name 3 possible non-motor symptoms in Parkinson's and their respective treatments.
I did it this week. Erectile dysfunction for real. You can treat with sildenafil.
Okay.
TB5, depression. So SSRIs. Yeah. And then what's another one? Look at this one. Non-motor. The biggest thing is motor. Yeah, I think it's like the dementia. What do you do for that?
What? I think it's okay. I think it's okay. I can't. Lauren, can you give us a test? Say something.
Yeah, I'm here.
Okay. Yeah, that's perfect.
No, because if you do the cholinergics, there are anticholinergics that you can use for movement stuff, but you can't give it to people over 65. So yeah, I guess maybe you add like a cholinesterase. So the cholinesterase would do that. So you say that. Is that okay?
Okay.
That's it.
Okay, so the question was name 3 possible non-motor symptoms in Parkinson's and their respective treatments. They came up with erectile dysfunction, treating with Viagra, depression, treating with SSRIs, and dementia with acetylcholinesterase inhibitors, and that is correct. 500 points.
Yeah, I got 600. That was 6 different answers.
Oh, I don't care. That's not how it works.
You got 500.
So Delta Schmeltz has 500. Thyroid Storm, would you like to pick? And also, I'm sorry, it's not going away. The things aren't going away, so I'll just have to take note of which have been used.
Oh, okay.
I don't know.
Oh, we'll just.
Okay. We're gonna do eating disorders for 500.
Eating disorders for 500. Yeah, Lauren, we're looking at you. Sorry, we're just since the answers or the options aren't disappearing, I'm having David draw a chart to know which ones we've used and which ones we haven't.
Which one are they picking?
We're doing eating disorders for 500. Name 5 criteria that may require hospitalization in a patient with eating disorders.
You just go straight to the
Guys, I need you to be quiet so I can hear them.
We are one. Yeah, we're Delta Schmelz, sponsored by Cluster from. Maureen.
Dun, 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 dun.
Okay, we've got some answers, I think.
Okay.
All right, syncope,
Syncope.
electrolyte like severe electrolyte abnormalities, critically low BMI. I don't know if you need like a specific number or not. At risk for refeeding syndrome and like other mental illness, specifically like suicidal ideation or something like that.
Yeah. Okay. Do you have a like specific BMI in mind, or you can do another one instead?
Lower than 16.
We'll say 16.
Or lower.
16 or lower.
Well, oh, that doesn't help me, but I'll give it to you. Yeah. So median median body mass index of less than 75% for age and sex is how they did it in the journal. But yeah, I mean, critically low BMI, I'll just count it towards you. Then you got electrolyte disturbances, acute medical complications such as syncope, co-occurring behavioral stuff, yeah, so sure, I'll give that one to you.
Nice. Is that better?
Yeah.
Was there any needed help? Alright, so guys, for the 500, we could do this just for neuropathy or random. Random, alright, random for 5.
Random for 500 is what Delta Schmelz is picking. Which best describes the long-term efficacy of platelet-rich plasma injections for knee osteoarthritis? Is it A, as efficacious as steroid injection, B, as efficacious as placebo, C, greater efficacy than hyaluronic acid injection or Synvisc, D, greater efficacy than steroid injection, or E, less efficacy than placebo?
I mean, long-term efficacy of steroid. I think it's B or B. Like for the article itself. Okay, you think so? I think it's not C because I specifically remember them saying that the comparison that they made was hyaluronic acid and PRP was the same over 5 years. I don't know, I feel like it's B, but so yeah, definitely not C. I don't think it's not B. It's yeah. Okay. So less efficacy than placebo, I would say no. Okay, like we'll say B.
The answer is B. So, yeah, platelet-rich plasma doesn't do shit. It's expensive. Quit doing it. Somebody try telling Dr. Hunt that, or all the all the orthopods at CIO.
Yeah.
So
I think it's mostly like tendinopathy. Just no, he does it for POA.
yeah. Yeah. Also, in the same poem, it did say that it doesn't do much for tendinopathy either. Essentially, you're just expanding the volume temporarily, whatever. All right. Back to you, thyroid storm. So eating disorder, Parkinson, and random for 500 have all been used.
We'll do peripheral neuropathy for 500.
Peripheral neuropathy for 500. A 71-year-old female with lower extremity sensory deficits and weakness. Lab workup has been negative. Physical exam shows brisk reflexes and clonus in lower extremities. What is the next best step? MRI, radiograph, physical therapy, electromyography, or nerve biopsy?
Okay, we're gonna guess A.
It is A. So this was taken more from the cervical myelopathy journal article, but it also had to do with neuropathy as well. So yeah, that's what you should do because they have central motor or central nerve signs versus peripheral. So all the other things don't really matter. All right, Delts Schmelz. Dysphagia for 5. An 89-year-old male patient with severe progressive dementia has had multiple aspiration pneumonias in the last 6 months. What intervention can minimize aspiration risk in this patient? NG tube, PEG tube, swallowing rehab, texture diet modification, none of the above.
None of the above. Calcium.
Are you positive?
It says it would minimize aspiration. Yeah, I mean, they're going to aspirate, but yeah, the first 3, no. You guys don't think that diet, like, they switch from like a liquid diet? Yeah, that's true. Okay.
So I'm not asking eliminate. I'm just asking decrease or minimize.
Well,
It's up to you guys.
I had a question. Yeah, I had a patient in the hospital recently that speech dog is pretty like moderate to severe dementia, and they just recommend like a diet modification.
What do you do?
Yeah.
But what does the journal say?
The journal say, David?
Okay. Well,
What do you want?
I don't want either. I'm cool with either.
What do you want? Final answer.
I think you get to be on that.
Let him die. Let's just say E.
Thyroid storm, you want to steal?
There we go. 5 seconds, Dave.
Yeah, I'll give you like 30 seconds for the span of a Jeopardy song. Okay, do you guys have an answer? Are you guys even paying attention? Are you there?
Hello?
Who are you talking to?
You! I said thyroid storm, do you want to steal?
Oh, oops, what did they guess before?
Well, that's not my problem.
All right, we win.
I guarantee you they probably said D already, though.
Just go with it.
They're not going to tell us what they guessed. Oh,
I'm not going to tell you what they guessed because you weren't paying attention.
It's either probably C or D. Okay, we're gonna go with D.
D is correct.
Woo!
500. So yes, with somebody with severe progressive dementia, there's not a lot you can do to keep them from aspirating. NG and PEG tubes do not minimize that risk. Swallowing rehab, it wouldn't be helpful in this patient because they wouldn't be able to participate in therapy, get its benefits. Diet texture modification is pretty much the only thing you can do. But again, the best thing to do for this patient outside of just thinking of minimizing aspiration risk is making sure that clear goals of care have been established with surrogate medical decision makers. And yeah, the evidence may be poor, but diet texture modification can potentially help. So yeah. All right, thyroid storm, you're up. All the 500s have been taken.
Eating disorder for 400.
The only FDA-approved pharmacotherapy for binge eating disorder. Methylphenidate, topiramate, dextromethamphetamine, lisdexamphetamine.
Okay, we're gonna go with D.
D, lisdexamphetamine.
Yeah.
That's correct.
Woo! Nice job, Chelsea.
Vyvanse is the brand name. So 400 for Thyroid Storm. David. David!
Oh, yeah. That's for 400.
Yes. Okay, what do you guys want?
Okay. Should we go with what we know? Parkinson's, yeah. Parkinson's.
All right. A 75-year-old male with progressive deterioration over the last 4 years, now experiencing episodes of being locked in for up to 10 minutes at a time. What are 2 potential treatment options for these episodes?
Wait. Has he been diagnosed already?
Yes. Yes. When I said progressive deterioration, I meant from Parkinson's.
Is he already on medication?
Yes.
So we're sitting instead of that. So 2 treatment options could be
For specifically these episodes, not for the Parkinson's in general.
So you can have, because I just
Can you stop this carbonated delivery or decrease or?
yeah, you can, so you can decrease the carbonated and then add another, so like a monoamine oxidase, inhibitor or whatever. Or you could add, what was that? No, he's over 65, you can't do it. Overtone, yeah. And then, I'm trying to think of what you can try. You can try, adamantine or whatever that is. Or you could do a deep brain, because I did a deep brain somewhere.
I think that's for like progressive. Like this is more like the I can't remember what it's called, but the bradykinesia. So anyway, whatever you say.
So I'd say maybe like increase. You can try increasing his cinnamon and increasing like starting him in the like the monoamine oxidase.
So you can say decreasing cinnamon and then starting at MAO.
Yes.
Okay.
Or starting at
Let's go with that. We do that.
What is your answer?
Decreasing cinnamon or starting like an MAO.
So I'm going to tell them because because they can't hear you. Their answer was add an MAOB inhibitor or decrease the carbidopa-levodopa dose, which is incorrect. So you guys want a chance to steal?
Did we get either right?
Dang it.
So you guys are thinking of something else. I want specifically these episodes.
Yeah.
Lauren, you want to steal?
Yeah, can we steal for like half and try to guess one? Because that's all we can come up with.
I mean, yeah, if you can only get one, you get half. I would have given you guys half if you got one and gave them a chance to get the other half. So if they only want to answer half, they can answer half.
Okay.
Pyridostigmine.
What's that?
Pyridostigmine or mestinon. So
What?
only guess. Oh, goodness.
Pyridostigmine or what?
Mestinon is the brand name.
No.
Okay. That's all we got.
Okay, so the question that was specifically asking was for the freezing episodes that they have. So treatment for these episodes. You can either give apomorphine, intranasal carbidopa-levodopa, or immediate release carbidopa-levodopa orally. They all have really bad side effects. They don't work great, but they do help with
I was thinking of like
freezing episodes.
like with what do they say that you can get like this procedure with
Yeah.
Yeah.
Yeah. Yeah, and you can have dyskinesias, but when they're getting severe as to being locked in or freezing up for minutes at a time, then you need something to address those specific episodes. And then you can go maximize their other therapy. All right. Parkinson's 400 was used up. So, Lauren, what do you want? Thyroid storm.
Yeah. Call us by our real name. Peripheral neuropathy, 400.
Peripheral neuropathy for 400. A 68-year-old with severe progressive diabetic neuropathy for 12 years still has significant symptoms after maximizing anti-epileptic and SNRI therapy. What are some options that can be used as adjunctive therapy? And I just need one. 400.
There's like conservative.
Hey Dylan, was there one specific answer you're looking for, or were there multiple options and like we just have to name one of them?
There were a couple options.
Okay.
I'm looking for, I mean, I'd rather, like, I'm thinking of one, but there are a couple options
Okay.
that were listed in the article.
Okay.
And
Topical. Sorry.
For
Go
this
ahead.
question, assume that they've maximized diabetic therapy, underlying causes, whatnot.
Yeah. Topical capsaicin, and then we had another answer that, I mean, I probably would have tried topical capsaicin by this point, but
Yeah, so that's correct. So topical adjunctive therapy includes capsaicin, lidocaine. You can use opioids if it's terrible, but those are typically last line. Yep, 400 for them.
Falling behind, guys.
We suck.
It's because there's
All right.
I think I
Delts,
What do you guys want here?
Delts, Schmelz.
now you do 400.
Random?
Yeah.
400 random.
Let's go random.
What is the only efficacious treatment for the prevention of seasonal affective disorder?
Yeah.
Vitamin D, sertraline, cognitive behavior therapy, bupropion, light therapy.
So you don't use for the prevention. So SSRIs can be used for the treatment, but not for the prevention. E is also treatment. I know that D
I was thinking.
can be
Vitamin?
prevention. Well, be true. I would say D.
I would agree. I was going to say D2.
I think that's CBD.
But it's for treatment,
No.
not.
Do you guys have a final answer?
Your question is confusing because what's the most efficacious treatment for prevention?
Treatment for prevention,
That's a great point.
not treatment for the disease itself.
All right.
Preventative treatment option, I don't know. It's for prevention.
We picked T. It's David's fault. D.
Okay, yes, bupropion is correct. You can use all the others for treatment of the underlying disease, but preventing bupropion typically started a couple months before their symptoms typically arise. All right, thyroid storm. You up?
Is random the only one with 400 left?
Dysphagia is the only one with 400 left.
Oh, dysphagia is the only one?
Yeah.
Okay, we'll do that one for 400.
Locations of EGD biopsy or biopsies that best diagnose eosinophilic esophagitis. Obviously. This is a no-brainer. Come on.
Like biopsy inside of a baker's
What?
All right, how many locations do we need to list, or do we just need to be able to name one?
This is kind of an all or nothing question.
Okay.
Okay.
We'll just do the.
Yep.
Okay. So can you tell us how many we have to say?
No, that's why there's the S. It might be one, it might be 5.
Fine. Okay.
The
EJ.
S.
Okay.
What?
EJ Junction.
Distal esophagus.
Distal esophagus. Last option. Hold on. We're going to think of the last answer here.
What?
Hold on. We need to think about our last answer.
You mean you need to look it up?
No, we have not looked anything up.
Okay.
Unless it EJ Junction, that doesn't exist.
And then the gastric antrum.
No.
Rude.
No. All right. You guys want to steal? There.
Okay, Alice knows it. Go ahead.
Do the 4 and the linear part, like starting at the lowest one,
No.
That's fine. I want
Yeah, that's the answer.
No. So you need a biopsy site from the distal esophagus and the mid-thoracic esophagus.
Which we would have covered.
Which we would have covered.
You didn't tell me the spacing?
No, I went like this.
Could be-
I definitely hit thoracic.
No.
It wasn't the EJ Junction.
It wasn't the EJ junction because that doesn't exist. That's lost. Yeah. Okay. You guys are up next.
I hit the thoracic.
What are we doing?
300.
Random for 300.
Random for 300. So a 22-year-old male gymnast presents with bilateral hip pain and limited range of motion. What is the cause of his symptoms?
We have more history, please.
No, there's an X-ray. I gave you a history. It's a gymnast.
The interior lateral or posterior?
I would like a broad
He's unable to specify.
how do we where's the plate? Oh no. It's over there.
Like the answer is with this.
Yeah, okay. Okay. So he's a gymnast. Do you think like it's a pubic symphysis thing? Or do you more like
Try it again.
I'm trying. What about this, right? Because that looks
What is
like
it that? It is from the back. Oh yeah.
Oh, I got it. There we go. There we go.
So if it's osteotis pubis, you would see sclerosis around, right?
Fun fact, when I wrote this question, I put female, and then I realized there's a whole lot of junk there. So I had to go back and change it to male. I don't know, I think I see a pretty definitive outline of a penis.
Limited range of
Limited range. So it's actually affecting the range of motion.
Dun 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 dun. Dun, 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 dun. Okay, answer please. Answer please. Answer please. Answer please.
This is a little weird, I feel like, and then there's like a little bit of.
I think this Q-angle is bad.
Answer please. Or does Jason have an opinion since he just walked in?
This is not an opinion.
Okay.
No, that's dysplasia of the hip.
Sounds good.
Okay, they answered congenital dysplasia of the hip, which is incorrect. Thyroid storm, would you like to steal? Thyroid storm, are you there?
Yes, we're talking over answers.
Well, when I asked if you want to steal, you got to say yes.
Okay, sorry. The answer is
Calm
yes.
down.
Oh my. Compression injury.
No, it is a cam deformity. The neck of both femurs is very thick, which will limit range of motion, especially in an athlete, and notice it more. Can be.
Is it a congenital thing?
No, this is a developed one because he's an athlete and a gymnast.
I said developmental.
No, it's a cam deformity.
What's the treatment?
I don't know. That's not part of the question. Physical therapy. Okay.
Thyroid.
Thyroid storm, you're up.
Neuropathy for 300.
The 3 highest yield laboratory tests to order for a suspected peripheral neuropathy according to the American Academy of Neurology.
I'm not sure, but I know that. Yeah, that's what I want.
All right. We're gonna go A1C, B12, and folate.
You got one, I'll give you one. You guys get to steal. This is according to the American Academy of Neurology. 3 highest yields.
Yeah, it was pretty, like 9% or something like that.
I'm not going to tell you which one they got right. They got one right.
Okay, so do you want to stay Kenny?
A what? Yeah. So I would have accepted glucose, fasting glucose, BNP. The top 3 are blood sugar, just a regular old glucose, however you get it, a B12, and a protein electrophoresis.
So how many points did we get?
You get 200.
We get 200? Nice, and they get 100.
I already gave them 100. I already gave them
Oh,
100.
nice, okay, good. Yes.
Okay, you guys are up. Let's make it snappy. We got to get through like all these.
Okay.
We're only like through half. So from now on, it will be 30-second timers.
Okay, eating disorders.
Eating disorders 300. True or false?
Yes.
OCPs in female patients with eating disorders can mildly restore bone mineral density and help restore normal menses.
Ooh.
Oral contraceptive pill.
Because the problem is the axis, the hormone release. If we do the hormone, they should have a withdrawal. It would be a normal menses, it would be a withdrawal. Sure.
True or false?
So technically, this is false, but I think what you meant is true.
Okay.
I don't know whether I'm offended or not.
So bone mineral density.
Do you?
So that part of the question would technically be true. Or bone mineral density.
Okay, you guys want to say true or false?
True.
It is false.
Dang it.
OCPs do not restore any bone mineral density in eating disorder patients, and they can actually cover up normal menses when they're actually getting back to a set weight. So I'm not saying that you shouldn't put them on oral contraceptives, because then getting pregnant can be very harmful. But you need to take the risks of, if you are going to start them on OCPs, it may cover up their normal menses, which is a very good indicator that they are improving from a weight standpoint. And an
Do we
endocrine.
have the opportunity to steal?
No, it's 50-50. But you get the next question. The only one left with 300 is Parkinson's or dysphagia.
Dysphagia for 300.
All right, a 42-year-old female who is otherwise healthy develops dysphagia with solid food for 3 weeks. What is the next step in diagnosis and or treatment? Food diary for triggers, PPI trial, EGD, barium swallow, H2 blocker trial. Thirty-second timer.
We're gonna go with B, PPI trial.
That is correct. If they had any other underlying bad history things, or if they were over 50, then you should consider an EGD. But with somebody who just develops dysphagia, they can do a PPI trial. So that's correct. You guys want Parkinson's 300? I feel like you guys want Parkinson's 300. What are the 2 approved uses for amantadine in the treatment for Parkinson's? There's 2 approved uses that were brought up in the thingamabob.
Dyskinesia. You can say that. And you say dementia. I'll say that. This seems like a $500 question.
Sorry.
500 question.
Okay, do you guys want to give a final answer? If you can only give one, that's fine.
Okay, so we'll get dyskinesia, and then the second one we will say what? Dementia.
Okay, so their answers were dementia and dyskinesias. They got one of those correct. You guys can get 150. Do you guys want to steal for the other half of that question?
So we got one. So that gives 150.
Thyroid Storm, do you want to attempt to steal?
Yes, we do.
Okay. I'll give you 20 seconds.
We're gonna say depression.
That is
Oh, they
incorrect.
said that's what. Hold on, they said depression.
Yeah, they said-
Oh, sorry, I misunderstood.
No, they didn't. They didn't.
They
They
said
said-
dementia. Okay.
They said dementia. Depression is incorrect. So the other, so the 2 approved uses are for dyskinesias and later in the disease. It also has some limited use for people with just mild, like tremors, younger than 65. It's not the preferred, but you can use it for that. All right, Thyroid Storm, you're up. You got 100s and 200s left.
Peripheral neuropathy for 200.
2 physical exam components that have a high degree of sensitivity and specificity for diabetic neuropathy in diabetic patients. You guys got 30 seconds. Ten seconds.
Monofilament test, and then just general like light touch sensation.
So you got half of it. I'll give you 100. You guys want to steal for the other half? I'll give you 10 seconds. Yeah. So you guys got monofilament. The other half was vibratory sensation. Again, that's only in diabetic patients that have a high degree of sensitivity and specificity. It has to be bilateral. Okay. All right, you guys, what do you want? This page is 200. True or false? Manometry should not be delayed after achalasia is suspected or diagnosed on EGD or barium esophography.
I don't know, that's interesting because you feel like if it's been diagnosed. Well, in TB, I don't think you can get the diagnosis. You have a barium esophagram. Yeah. I mean, I know it's the next step typically. It's like when they do barium, you can do manometry.
20 seconds.
See what the pressure is.
How long what do you mean by delay? Like immediately that day do it, or like?
Like that should be your next step.
Sure. So, is it true?
Yes. Yeah, that's
True.
It should not be delayed.
True.
It should not.
Actually, it's false. It can be delayed. You can optimize medical therapy first. The reason behind it is manometry can diagnose a lot of like spasm disorders that are actually just functional, like esophagus or functional esophagus dysfunction. So that leads to a lot of unnecessary testing and a lot of unnecessary dilations and procedures. So you can optimize them with like a PPI trial for like up to 3 or 4 weeks. And if they're still having issues, you can then do a manometry. Yeah, that's one I thought was interesting. All right, since that is true or false, you guys don't get to steal. But you're up next, Thyroid Storm. Eating disorder, Parkinson, and random for 200.
Eating disorders for 200.
Which of the following medications are contraindicated in anorexia nervosa? Mirtazapine, sertraline, bupropion, olanzapine.
C, bupropion.
Yep. That was a gimme. That one was a gimme. That one was a gimme.
Parkinson or random? Alright. Random for 200.
Name 4 of the 7 Wells criteria.
Alright, 4. Well, you know what I'm calling?
Suspicious or high suspicion for. I know that more. Yes, for PE or DVT.
PE.
So, I think it still will include
Recent surgery, cancer, high suspicion for PE, right? Well, I think there is no other, it was like, no other more likely diagnosis. Yeah. Recent surgery with DVT. Homocysis? Yes. I like that too. Let's just name Winnie and Ball.
You guys named 4 at this point, so I'll give it to you. It is signs or symptoms of DVT. Diagnosis of P is more likely than an alternative diagnosis. Heart rate is greater than 100. Immobilization or surgery in the past 4 weeks. history of DVT or PE, hemoptysis, or cancer. Active malignancy. All right. You guys want Parkinson's 200? I feel like you want Parkinson's 200. Thyroid storm?
Sure.
Why not?
I mean, you can pick 100 of anything else, but that's the highest. Okay, Parkinson's. Which of the following is indicated in Parkinson's patients with a history of schizophrenia? Selegiline, amantadine, carbidopa, levodopa, pramipexole.
D, pramipexole.
That is true.
Ooh, nice. Good job, guys.
The dopamine agonists are contraindicated in people with history of psychosis, schizophrenia. Okay. There's 100s.
Random 100.
All right. A 67-year-old male with COPD has increased cough, dyspnea, and sputum production. What lab value can help guide therapy?
I read this. SCRP.
Okay. There, you guys, final answer? Okay. They got CRP. CRP is correct.
I read this.
So it was one of the poems. There's a pretty decent sized study showed that getting a CRP level in COPD exacerbations can help guide antibiotic therapy. So anything less than 2 doesn't need antibiotics. Anything over 4 should get antibiotics, and anything in between, kind of leave it up to your clinical judgment. So, like outpatient. Yeah.
All of them?
Outpatient.
It's just outpatient.
I think the study was performed on outpatient. So. All right. Thyroid storm, you got dysphagia, peripheral neuropathy, eating disorder, or Parkinson's. 100.
Neuropathy for 100.
Which of the following patients should get electrodiagnostic studies? 67-year-old female diabetic, pain and numbness, 4 years, stable. 86-year-old male alcoholic with tingling in his bilateral hands. B12 deficient 45-year-old with previous numbness and weakness. Weakness improved with B12 supplementation. Or 34-year-old worsening weakness, bilateral legs over the last 4 months.
I'm going to go with D.
D is correct. Something that is sudden onset or rapidly progressive or in a younger patient are all signs that you should get electrodiagnostic studies. All right, what do you guys want? Dysphagia, eating disorder, or Parkinson's?
I don't care. There you go.
Dysphagia for 100. 56-year-old female with no previous neurologic dysfunction suffers a stroke and now cannot swallow thin liquids without significant aspiration. What intervention improves long-term outcomes? Temporary NG, speech therapy, PEG placement, formal discussion for goals of care.
I mean, I just think of like after stroke therapy is like the best way.
What? But yeah, recent. 2 weeks ago. I don't know. 1 week ago. I don't know. Recent.
If you're confident, can you I mean, what are the other episodes? Does she have a feedback?
No, she has no progressive neurologic dysfunction. No. Well, I haven't seen the patient. I don't know if she can talk. I just got this page. B is correct. Speech therapy will improve long-term outcome, especially. Well, you should, but that's not going to improve long-term outcomes.
You can talk about it one time. Over.
Speech therapy. This person has pretty good, since they don't have any previous neurologic deficits, and this is an acute event, they should still be able to. They have good therapy, whatever. All right, eating disorder or Parkinson's?
Eating disorders.
17-year-old female diagnosed with anorexia nervosa. What is first-line treatment? SSRI, family-based therapy, self-guided therapy, cognitive behavior therapy.
C, family-based.
Yes, family-based therapy is correct. You gotta give them 100 first. Okay, fine. Parkinson's. First-line therapy for a 61-year-old female with tremor and bradykinesia not yet interfering with her job or home life. Newly onset, let's say she was diagnosed last month. Selegiline, carbidopa, levodopa, razagiline, amantadine.
Because you were saying earlier, you can give them amantadine for motor concerns when they're less than 65, and it's like mild.
Yeah, but I think you also said it wasn't personal.
Oh yeah, but then also they say it's cinematic. So it's either between B or D. So that really says it's not interfering with their job.
Come on, we got Final Jeopardy after this. It's a really good question, so hurry up and answer. You guys guess B? You guys guess? You guys think it's B? You guys think it's B? Well, you're wrong. It's C. Razagiline, razagiline, MAOB inhibitors are actually first line for people younger than 65.
I know. I said that.
And we're not gonna have you guys steal. We're not gonna have you steal because we got. It's a 100 question, and we need to do Final Jeopardy.
What if we lose by 100 now?
We got clear soon. Okay. All right.
Not fair. They also got to answer one.
Storm, you got
extra
3,400. Delta Schmeltz has 2,250. Here's the Final Jeopardy.
And we answered 12.
Yeah.
Here's the Final Jeopardy category. Entertainers with multiple awards.
We're betting it all.
So, well, you're not supposed to tell me that. Okay.
I would like to point out that you guys got to answer 13 questions and we got to answer 12 without being able to steal on that last one.
You're already winning. Just send me a text of how many points you're going to wager on the Final Jeopardy. Please.
How many points do we have and how many points does
3,400.
How many do they have?
2,250.
20 awards?
And
Send me a text. I want Warren's going to send me a text, and then Lauren is going to send me a text. Not to confuse the two. Entertainers with multiple awards. Okay, I need your wagers now, or else I'm not going to let you wager anything. I got Warren's. Lauren, I'm still waiting.
Email.
Okay, is that your serious wager, or are you just being mean?
Serious. Texas with a dollar. Serious. Do it.
Okay. Lauren, is that your final answer? Wager?
yes, it is.
Okay. Who is the only actor or actress to achieve REGOT status?
Ooh.
That is an Emmy, a Grammy, an Oscar, a Tony, and a Razzie. Razzie is for terrible performance. Like, the movie or performance was so bad, they gave him an award for it.
So it's an actor or actress. So it's gotta be someone who can sing.
Lauren, I'm going to have you text me. For those of you who don't know, Emmy is for TV, Grammy is for music, Oscar is for movie, Tony is for Broadway musicals, Razzie is for being terrible. No searching. Thyroid storm. Guys, I need an answer. Lauren sent me her answer. Hey, put your phone down.
I was gonna send it.
Okay, send me.
It has to be someone from the modern era. Can we just figure out the answer? What do we do? Let's do recap status. Are you serious?
Just send me an answer. Anything.
All right.
Oh my God. Send me.
I don't think this is right either. I don't think this is right.
All right. Okay. So T and Delts Schmeltz, their answer was Russell Crowe, and they wagered 2,249. The Thyroid Storm wagered 100 points. Their answer was Cher. The answer was Liza Minnelli.
Oh, please.
No, I'd say they were more close than that. All right, Thyroid Storm won. Thanks for coming.